Doctors of Reddit, have you ever had to fire a patient? If so, what was the straw that broke the camel's back? Dentist, one time I refused to see a patient after they refused to stop chewing gum. I mean, during the appointment, I asked her 3 times, and every time she pretended to take her gum out, which, at 16 years old, seemed pretty childish. I finally worked on her, and as I took my hands out of her mouth for an instrument, she started chewing again. It was still in there. I told the parent that their daughter was not ready for braces. They argued, but she would not follow the simplest instructions, let alone habits she would need to form to keep her teeth clean throughout treatment. She sounds incredibly stupid. Dentist, after spending multiple appointments explaining concerns with healing after an extraction, she continued to be argumentative and then said, "You Arabs are so stubborn." I told her she can be a racist out on the street but not in my office, so please leave. As a side note, I'm Iranian and I practice in Canada. I came here when I was 9. No man, number, your skin looks different than mine, you are clearly a terrorist. Drug addict who basically refused to try to change anything, was on RX narcotics and benzos, then one day ended up in the air. The drug screen in the air showed no benzos or Nox, which confirmed my suspicion she was selling them. In retrospect, everything she was on had some street value, including her antidepressants. People will use anything here, snorting Wellbutrin, etc. I have fired 2 patients in my career. The first was a family of a man about to have a planned surgery. They were upset that they had to wait until the following week to see the cardiologist, and because of their influence, they called their state representative. He called the hospital CEO, who called me. I explained the situation. I then called the patient and told him that trying to force the system to work solely to his advantage was not how this was going to work. I explained that the doctor-patient relationship in non-life-threatening situations is voluntary and gave him a list of other specialists in our area. The second had a wife who was very mean to my staff over several visits. In their last visit, she made my lead nurse cry and actually hit one of the techs as she was helping the patient put a sock back on. The patient made no apology for her, supported her actions, and seemed to think that this was normal behavior. That first guy, what a bunch of selfish pricks. When I was a paramedic, a call came in that a child was suffering from a severe peanut allergy. She was 7 and her older brother thought it would be funny to force feed her peanut butter. Either way, get her loaded in, but the mom is just dragging her feet. She forgets her purse, then her phone, then her brush, then her gum or whatever. I just sort of waved at her. "Hi, we need to go to the hospital now. Child, sick. Hospital, let's freaking go." So, she waddles her way over to the ambulance and gets in. It took about 3 minutes before her phone is out, and she's snapping pictures of her daughter for her Facebook page. One of those, like to make my baby better things. So once again, I just sort of wave at her. "Hi, please stop, we're trying to help your daughter." She ignores me. More Facebook or Twitter pictures. Click, click, click. I just lost it. Stop taking freaking pictures, you dumb freaking see. Then I took her phone away. So, now mom is flipping out because I took her phone away. We get to the hospital and mom is still flipping out over her phone being confiscated. People at the hospital think she's distraught over her child and try to calm her down. They figure out it's about her phone being taken away by the mean man in the ambulance. They quarantined the so-called mom in the waiting room until she calmed down about her phone. Hospital security came to me, got her phone back, and she was allowed to go in and see her daughter, provided she stopped taking pictures of her daughter and instead tried to comfort her. Click, click, click. Like to save my baby. Click, click, click. Then I hear the attending MD just explode. "Okay, get the frick out. Just get the frick out of this room." I guess that would count as being fired. I'm a specialist. There are only a few things that will get a patient fired. Verbally abusive with my staff. I have zero tolerance for this one. A patient can get mad at me and yell at me all day long. I can't take it. My staff is different. They don't get paid to be abused. Period. I will always stand up for my staff. Chronic no call no show. 3 in 1 year and you are out. I have a 3-month wait list. I will keep my spots for patients who want to come. Other than that, there are patients where we mutually agree to disagree and we part ways amicably. As someone who used to be a secretary in a doctor's office, I know your staff fully appreciates this even if they don't say so. After working there 3 years, I left that office and never looked back after being verbally abused almost daily by patients and having the doctor shrug it off like it was no big deal. Thank you. Not a doctor, but I work at a pharmacy and we got a guy thrown out of 2 practices. He was doctor shopping and getting oxycodone prescriptions from both. Once a year, my mother sits down with her big list of area pharmacies and calls them all. She usually finds out a few people are doctor shopping, and one time she actually discovered someone had been forging her prescriptions. She writes these people a letter to formally fire them. I was asked by my psychiatrist how I was and I told her I didn't want to be there. I was less than 14 years old, just telling the truth. Anywho, she told me to leave and she talked to my parents. That was the last I saw her. I know we don't have all of the details and probably can't find out what happened for sure, but I just pictured your psychiatrist asking the question, expecting you to say how awesome he was, and then getting genuinely offended when you said you didn't want to be there. It gave me a giggle. I've fired a number of patients, and likewise been fired. Sometimes it just doesn't work out. For one of my colleagues, the last straw was having the patient break the exam room wall with her head and then leave screaming obscenities at her. I actually chased that one out myself. Falling glass on the other side of the wall almost hit my own patient. First patient I ever fired myself tried to destroy her own medical records. A wise doctor I knew early in my training once said, "The only things I'll fire a patient for are physically abusing me, abusing my staff in any way, or calling me at home." Seems about right. I'm a psychiatrist. Always M. Don't use it and then come to me with psychosis and tell me you're bipolar schizophrenic. It may work on some, and, in a field where a lot of care is done by less trained social workers, it's common. But I went through far too much school and hard work to be fooled that easily. I'm a nurse practitioner in my area, and because we are an urgent care, we get a lot of doctor shoppers, but in California we can look up the narcotics record, so at least once a day we will tell the patient that it seems like they are fully stocked from another doctor and that they are not going to get any more. Usually they will be resigned, but sometimes they will get super defensive. There is a mother and son that stole the main doc's D number and called in poorly worded narcotics on an elderly person. We so fired them that we turned them into the police. Dang, the guts, the nerve, the plain stupidity. Kindly denying it, but leaving the hospital would have worked so much better. The reason you don't see a lot of physicians posting here is because this happens on a daily occurrence for some of us. It's also a touchy subject, because it touches on the principle of abandonment. We're supposed to make sure someone always has access to care. That said, it happens quite regularly for all physicians, with the possible exception of ED docs for the reasons above, but departments have other ways of protecting staff from abusive patients. I wish I could tell you a great story for most of these, but the truth is that like many jobs, ours is full of banalities you don't see on TV. We've all had crazy patients, but the vast majority are removed from practice for bland reasons. In the ambulatory setting, the most common reasons include repeatedly failing to show for appointments on time, prescription drug abuse, and failing to pay. The inpatient setting is different, as you have to have a certain acuity of illness to be admitted, but the most common reasons there are more related to abuse of staff and refusal of care. Then there's the areas of interesting controversy. What if your patient refuses a vaccine? Providers and patients give dramatically different responses to that one. Happens around 30% of the time according to a recent AAP article. Another example, one concern about the increasingly popular pay-for-performance model, where 90% of your diabetics need to be well controlled for reimbursement, is that it might create pressure to fire those pesky milkshake addicts. TLDR. Happens all the damn time. I work at administration at a surgery center, but we wouldn't even look at one patient after he threw a chair at me when I told him how much he had to pay our facility. It's not always easy to refrain from throwing furniture at you guys. Not the doctor, but I am the girl that writes the "you're fired" letters to the patients. In 4.5 years I've probably written something like 40-50 letters. Most are people on narcotics that have come up positive for other drugs multiple times. My doc is nice and likes to give people second, third chances. Other times it's for doctor shopping or seeing multiple doctors for the same issue. Some are for multiple no-shows or cancellations. Most recent had 64 cancellations in 3 years. The rest are due to bad behaviors. One was calling the doctor and practitioners horrible names in the waiting room to other patients. Another screamed at everyone in the facility because she had history of filling meds early and we refused to give them to her early anymore. Another kicked out our glass door because we wouldn't give her narcotics. She wasn't even prescribed them. Another called over 25 times in one day just straight up harassing us because we wouldn't help her commit fraud. There's lots more. These days though, we don't have to write letters most of the time. They get blocked due to non-payment of their bills. Once they are blocked they can't make appointments, and without appointments they get no meds. So suffice to say this has caused a lot of drama lately. Nurse. One of the docs on our unit refused to assume care of a patient because every time they would place a PICC line for IV nutrition, which he needed because of his diagnosis, he would use it to shoot up all sorts of stupid crap. He put beer in it one time, crushed up oxy and shot that up, and so he would get a massive bloodstream infection. After the third or fourth time, caring for him became such a liability. I was dumped by my first obgyn. After I had my daughter I needed to research my birth control options because I still got pregnant on the pill. He gave me the depot shot without my permission, like they told me it was something else. So my next step I got the NP and doctor and I was like I was interested in this, and she goes oh no you got the shot and I was like no. I said I didn't want that. I don't want the depot. It will mess with me. She looks at the chart and sees my consent was never signed and the doctor tells me I need to sign it and I refuse. I was but I was 17. I didn't know just how bad I had been fricked over. My next apt it was just him and he basically told me to find a new obgyn. Looking back I rolled a pitched a huge fit, but being young I didn't know any better. This is actually a pretty big deal. He dumped you because he was worried about you suing him for malpractice. You probably would have won if you had. My dentist was fixing a cavity of mine once. She said that when she was a resident she had a patient who told her that when I, the patient, tell you to stop you need to stop right away or I'll punch you in the mouth. They both had a good laugh over that. Then the patient told the doctor no I'm serious. The attending told my dentist to finish up with the patient and then tell the patient to never come back. I had gingivitis when I was a kid, and the assistant at my dentist used to stab my gums when she was cleaning, to the point where I thought it was deliberate. I kept saying ow and she kept telling me not to be such a baby in a super bitchy way. It's entirely possible your dentist was like that, and you just weren't getting the full story. I was the one that got fired. Long story, but I was having problems for about 6 months and was sent to the neurologist in my small town. When I got there the doctor didn't have any of my files and straight up told me so. I told him what was going on and he prescribed me 3 separate pills for headaches, insomnia and nausea. Well, I researched these pills before I picked them up and decided not to take them. It would have masked my symptoms and I thought I wouldn't get a diagnosis. I saw him after another MRI and told him I didn't get the pills he prescribed. He told me I needed to leave because he wasn't going to give me oxytocin. I tried to tell him that's not what's going on, I just wanted to know what was wrong with me, but he had no shoots to give. 3 months later I was diagnosed with a somewhat rare malformation and large cysts in my brain. I have neurosurgery in November. We plan to sue the doctor for malpractice, but I'm waiting until after recovery to talk to a lawyer. Talk to a lawyer now. You don't have to file until you are feeling up to it, but best to get the ball rolling. First like, first view and first comment #feature me.